Hi everyone, I'm Kent. For those of you who came in a little late, I'm one of the directors of the film, along with my co-filmmaker, Marion Cunningham. I'm just so happy to be with you all today. We finished this film during the pandemic, and so we haven't done many in-person screenings. This is one of a handful, so thank you all for being here. So I want to achieve two things with you all today. The first is to guide you through the new science that's been published since we finished the film. There's been a big change. There's been an explosion of scientific interest in this topic, which is really exciting and is showing how it's moving more from the fringes into the mainstream. Secondly, I'm going to offer a guided exercise that will bring some of these concepts from the screen into the room. But before we get into the science, I'll tell you a little bit about my story, because these mind-body principles really have changed the course of my life. I came down with chronic pain when I was 22 years old. I developed a burning, aching pain in my right arm after a day of heavy weightlifting. You might not peg me as the weightlifting type, but I was hitting the gym pretty hard. That pain spread to my other arm and into my fingertips. The doctors diagnosed me with tendinitis. They recommended physical therapy and opioids. But after months of trying these things, I was getting worse and worse, and I had to drop out of college because I couldn't type my papers. I had to move in with my mom. As you can imagine, no college student wants to move in and live with their mom. And, I was really at a point where I was worried that my body might never get better. I might be sort of disabled forever. I had some pretty dark days. Then I read a book by Dr. John Sarno called The Mind-Body Prescription. What really got me about the book, it was his emphasis on resilience. He explains that the body has evolved over millions of years to heal from an injury, and that when pain persists, it's rarely because that the body's still damaged. Instead, it's usually that the brain has learned how to produce the pain because of fear, anxiety, stress, or trauma. Dr. Sarno says you can overcome the symptoms by recognizing that the body is safe and strong, by reducing fear, and by processing emotions. This was such a hopeful message, and it immediately made so much sense to me. I was able to recover the next day. And trust me, I recognize it's a little rare and kind of weird to be one of these people who reads a book and has this immediate healing experience. But here we are. I decided to make this documentary because I wanted to know if what worked so well for me could work for other people. And that's what led me to set off with cameras to film with one of Dr. Sarno's proteges, Dr. Howard Schubiner, who you saw in the film. This film was finished and premiered at the Austin Film Festival in 2019. Since we premiered the film, Dr. Howard Schubiner and his colleagues have continued to publish groundbreaking research. And I think it's so important to highlight these studies because despite what many physicians think, this is not a woo-woo treatment. It's based on cutting-edge neuroscience, and it's been verified as one of the most effective treatments for chronic pain in high-quality randomized controlled trials that have been published in some of the top peer-reviewed journals. If that sounds like a lot of jargon to you, it's just a way of saying that for nerds like me, there's been a lot of cool stuff coming out. So one study that was published last year in the Journal of Pain, it takes a closer look at chronic back pain. The physicians reviewed MRIs, they took careful histories of 222 people that were coming in to see a doctor in a clinic in Louisiana. These patients were not interested in the mind-body treatment. They weren't interested in neuroplasticity, right? They were there for the standard treatments for back pain, that is injections, medications, and surgery. Does anyone have a guess of what percent of them ended up having a mind-body or neuroplastic condition? Is anyone willing to hazard a guess? What? Oh, you didn't say it. Is anyone? Yeah, go. 75%? Okay, high number. All right, I like it. Anyone else want to guess? 90%. So, yeah, it's 88%. 88% of people had a mind-body or neuroplastic explanation for their chronic pain. And just for clarity really quick, mind-body and neuroplastic, those are interchangeable terms that different practitioners use. Of the remaining people, 5% had a structural pain from damage in their back, and 7% had a mixed presentation, so a combination of neuroplastic and structural damage. So this is an astonishing fact. At least I find it astonishing. I'll let you guys feel however you want. Seems like some of you already knew about it. Kind of an impressive guess you made. It's important to note, though, that this doesn't mean the patients had clear MRI scans. So 90% of those with a mind-body pain had disc bulges. 82% had osteoarthritis, right? 47% had disc degeneration disease. But those abnormalities did not explain their pain. As we saw from the film, it's very common to have scary MRI findings but no pain. And these findings are what Dr. Sarno calls normal abnormalities. So that's a pretty dramatic number. 195 people out of 222 have neuroplastic condition. And I want to give you a sense of how they reached these conclusions. After ruling out a clear structural injury like a tumor, an infection, or a fracture, they used this new assessment tool that Dr. Schubner created. You got a little sense of it from the film, but it's much more detailed. So the 3-minute scenes in the film are actually 3-hour conversations that we had to really simplify to make sense in the film. So I'm going to flesh this out a little bit for you. I personally think that this diagnostic tool is something actually everybody should learn and know how to apply for themselves, because we all get physical symptoms from time to time. And it's just hard to know, is this a mind-body thing? Is it related to stress? Or do I have damage and I need to go get it checked out medically? Right? It's very hard to know. And sadly, I can say, of the 8 doctors I saw for my neuroplastic condition, none of them helped me figure out that I had a mind-body or neuroplastic condition. It's not something that's taught in medical school. And 20 years later, after I've recovered from this mind-body condition, it is still not taught, not understood by the vast majority of doctors. So you guys are going to be on the cutting edge. If you follow along with me, you'll know how to use this tool. The tool is called the FIT criteria, F-I-T. So it involves looking at your symptoms and trying to assess if they are F for functional, I for inconsistent, and T for triggered. So I'm going to ask a series of questions that doctors using the FIT criteria would typically ask. And I invite you to use these questions for yourself, or maybe a past condition you've had, or if you can't think of anything going on for yourself, you can imagine a patient or maybe a friend of yours. Asking these questions can be uncomfortable, but I think it's really important to bring these uncomfortable things out into the open, and it's a way of destigmatizing my body conditions. Even though my body conditions are so common, they're still heavily stigmatized. And I think when we can talk about them, it's good. You know, with my own neuroplastic arm pain, I had it myself. I had a mind-body condition. I'm not to blame. It's not my fault. I wasn't imagining it. I'm not crazy, right? It's human. It's a human condition. So, the first category in the FIT criteria is functional. Functional is a term that doctors use when they do a search for some kind of damage or some kind of disease process and they don't find anything wrong, despite people having real physical problems. So here's the questions. You guys ready? Did the symptom persist after an injury would typically heal? You can ask that yourself. Ask that of yourself or imagine a scenario. Did the pain or symptoms spread to other parts of the body, or did they grow larger over time? For my thing, I had pain that started here, then it spread down here, then it went to my other arm, right? An injury doesn't spread usually. If I injured part of my arm, it wouldn't go to the other arm. Does my symptom move around, like up or down the back, or from side to side? It's really common for people to have pain up here, and then weeks later, the pain might be down here, then it might go back up again. That's a sign of neuroplasticity. Structural damage doesn't work like that. If you have GI or bladder issues, did a doctor come in and say, we didn't find a disease, we didn't find anything wrong? If the symptom is in a symmetrical pattern, like both hands, both arms, both legs, that's a really common sign of neuroplasticity. And then it's also important to note that there's a series of diagnoses that when doctors rule out a structural damage disorder, they'll give you the name of this particular condition. And it very likely, if you have been given this diagnosis, that it's a neuroplastic condition. So I'm just going to list those conditions. Fibromyalgia, migraines, tension headaches, POTS, burning mouth syndrome, long COVID, ME, CFS, or chronic fatigue syndrome. Those are diagnoses doctors resort to when they rule out structural problems like multiple sclerosis or rheumatoid arthritis or other things that are physical damage problems, cancer, things like that. Okay, second category is inconsistent. When you have a structural injury, the symptoms tend to be relatively consistent. A sprained ankle will hurt every time you take a step on it. It won't stop hurting on the weekends or when you're on vacation. Not so with neuroplastic symptoms. Right? One of the funny things about them is they're kind of context dependent. They can be funny. People can wake up with really severe pain in the morning, really severe back pain, and then in the afternoon they have much less pain. Why? Someone who gets hand pain every day from typing at their job, right? They'll have hand pain in the evening, and they associate with typing. But then they'll have hand pain on Sunday evening when they have been typing or using their hands all day. Aha, maybe notice some inconsistency, right? So here's the questions for inconsistency. Do my symptoms vary dramatically because of the time of day? Do they have a delayed onset, meaning do they occur after but not during an exercise or an activity? You go running and then you have foot pain the next day. That's a delayed onset. That's a sign of neuroplasticity. Do symptoms get worse when you think about them or when someone asks about them? Like when someone like me is asking you guys all these questions. Lastly, we have triggered. Triggered refers to when symptoms are brought on by some kind of stimulus that makes your brain afraid. So the doctor would ask questions like, is your symptom worse when you're going in for a medical test? Is your symptom worse when you're visiting an annoying relative? Is your symptom worse when you're attending a social gathering? These are not things that would typically impact or make a big difference for a structural damage condition, but they can be very different for a neuroplastic condition. Is your symptom triggered by merely imagining an activity? That is scary. So if it's someone with back pain, just imagining bending over can sometimes trigger the pain. Or if you have hand pain, imagining typing will sometimes trigger the pain. That's a sign of neuroplasticity. So I'm curious, that's FIT criteria in a nutshell. I'm curious if anyone in this group, as they were listening to the questions I was just going through, did anyone get a different vantage point on their own symptom or their own body? I'm seeing in the lab here. Anybody? Yeah. It's a powerful series of questions. So I haven't had a chronic pain problem in 20 years. I use the fit criteria probably every month on something. Some little thing comes up and I'm like, what is that? It's neuroplastic. Do I need to see a doctor or not? And I just go through the questions. I have them memorized by now. And I have to say, it saved me a lot of time and money. It costs a lot of money to see a doctor. It takes a lot of time. And if you get good at distinguishing neuroplastic from structural damage, it will save you a lot of time and money. Okay, I want to stress that these criteria, they can be really helpful, but even if your symptom exhibits none of these characteristics, they can actually still be neuroplastic. There are many examples of people with a really steady, consistent symptom that's based at a location where there was an injury, but then when they take on the mind body healing work, they find that their symptoms resolve. So it's really important to say that because the fit criteria is just a starting point for exploration. All right, so I'm pretty impressed that many people guessed this 90% figure, 88% of chronic back pain, but you guys are in the minority. Many people would respond to that by saying 90% is neuroplastic, you're saying that doctors can't help me, you're saying there's no medical treatments I can do, what am I supposed to do with this information? What a depressing study, thanks so much. And that's where my second study comes in. So we reviewed the cutting-edge diagnostic procedures, and I want you to know about the cutting-edge treatment for pain, because the numbers for those are equally jaw-dropping. This next study was published in JAMA Psychiatry in 2021. What they found is that when they randomly assigned people to receive 4 weeks of pain reprocessing therapy, the 66% of them who had had back pain for an average duration of 10 years became pain-free. There is no other treatment for chronic pain that sees anything close to those results. One person in the study who was a former football player who had a history of multiple spinal injuries was able to fully return to all the activities that he loved, and now he's happily riding a bike up and down mountains. So I want to acknowledge that studies like these, they only go so far. They can be a little abstract, maybe a little boring, but that's why I want to offer today like a guided exercise. I want to connect you more directly with some of the emotions that you saw in the film. I want to try to bring this from the conceptual into the visceral, bring it into the room with us. So this next practice is called getting in touch with your anger. Don't worry, we're not going to throw any chairs. It's going to last just 3 minutes. And if you don't want to do this exercise, that's totally fine. You don't have to participate. Anger for most people is a very scary emotion, right? It's a feeling that many of us downplay or try to ignore or try to hope will go away. We submerge our anger without even knowing that we're doing it. And submerged anger, as we saw in the film, is one of the main causes of pain, fatigue, sleep disturbances. If you're anything like me, you have a certain way of dealing with anger. I call it squashing it. It comes very naturally. Is there anyone else who squashes their anger? Okay, seeing some nods, not just me. So when somebody does something that hurts us, instead of realizing like, oh wow, I'm really angry, we often kind of talk ourselves out of it, right? We say things like, oh, I'm not that angry, plus that person's so difficult, they'll never understand. I'm just gonna keep it moving. Like, it's fine, it doesn't matter, I'll just keep moving, no big deal. And we sense this energy of anger as you're pushing it down, denying it. That energy goes somewhere, right? We ignore it and dismiss it at our peril. We ignore it and dismiss it and we wonder, why are we having so much trouble sleeping? Why are we having this pain? So with this exercise, we honor the feeling of anger. I want to invite you to find sit in a way that feels comfortable right now. Make yourself comfortable. If you feel comfortable doing this, I invite you to close your eyes. We're going to go for just 3 minutes. And I'm just going to guide you in an experience of this. These questions are not so much to answer with your intellect. You kind of want to ask these questions of your body. Just drop them in and see what happens. So take a moment and think of an incident in your life where you feel like somebody hurt you in the last 6 weeks. Don't pick the most dramatic thing or something really intense. Pick something that feels approachable. And bring that moment to mind. Some kind of conflict, somebody you care about did something disappointed you or hurt you. Just remember that. Remember how you felt in your body. Remember where you were, maybe where you're standing or sitting when that interaction happened. And then pay attention to your body. How are you feeling physically, the direct physical sensations? Most people, when they are hurt, they notice tension. That's the dominant feeling, tension. So you might feel some tension in your chest. That's good. You just want to notice it. Be curious. You don't need to get rid of it. Just notice the physical sensation of tension or maybe tightness. See if you can take a deep breath through the tension. And now we want to reach past the tension into the feeling that's underneath the tension. So anger triggers anxiety, it triggers tension, but it is not the tension itself. Anger is something deeper, more profound. So you want to reach through the tension and invite that deeper feeling into the surface. Anger is more likely to feel like heat. You might notice your heart quickening. You might notice some twitching in your legs or your hands, some muscle strength there, right? Anger is something that is protective, protects yourself or protects someone you love. So you're reaching through this tension, setting the tension aside, and allowing yourself to connect with the felt sense of anger. If there's anything that anger wants to do, it's good to acknowledge that. The anger may want to stand tall, it may want to project your voice, it may want to hit. Right? It's safe to notice this in the quietness of your mind. It's not going to hurt anyone. The desire to hit's not going to hurt anyone right now, right here. It can feel threatening, but it's actually more threatening to deny this and ignore it. So wanting to protect yourself is a positive thing. Then we want to ask, what would anger say? Now that you've connected with the felt sense of anger, what does it need to say to protect you, to protect a friend? Sometimes it's simple, right? Sometimes it's like, don't do that, or that hurt. Don't do that again. Imagine yourself saying this to the other person, what feelings are coming up. Speaking with anger, drawing a boundary. And then sometimes when we get in touch with anger, we feel a mixture of other feelings coming up too. There might be some guilt, some remorse. Maybe you don't feel like you acted to your standards. Maybe there's some regret or heaviness or tears coming up. You can make space for that as well. Getting in touch with anger often gets us in touch with our guilt, with the heaviness, and it's important to make space for that. So now we're going to conclude the meditation. You can open your eyes, reconnect with the world around you. If you notice any change in your current symptom, like your current pain or other symptom, that's useful to recognize. Often when we feel really angry, maybe our back pain is like 10% what it usually is, right? Then you're seeing a connection between anger and pain. But that's not true, just like with the fit criteria, it's not true for everyone. Sometimes there's no obvious connection, especially when you first approach it. But regardless, everyone can benefit from being more comfortable knowing when they're angry and expressing it in a healthy way once they've spent some time with it. Okay, so that is the end of my talk. So if people don't want to leave their home, there is a lot available online. And you can find those out on our website, thismightwritephones.com, and all the citations from the studies I referenced. And I just want to end by thanking Dr. Robert Peretti and Dr. Joyce Michael Flynn. Thank you so much for having us. Thank you.